people are coming in. Welcome to the last day of Women's History Month. But of course, Women's History happens every single day, all day, every day. Here we go. All right. Well, good. It's 6:34. I'm Leah Goodwin. I have the great honor of helping the Multicultural Health Foundation as their campaign liaison. And we have an exciting time this evening with some of our local sheroes, and we'll be doing some reflecting. So we're really happy to be partnering with Black San Diego, our community partner, Tanisha T. And we have Dr. Susanna Flalo, our family physician, founder and CEO of A Healthier Me, Dr. Kelly Elmore with Viva Life Health Hub, and Jaleisha Smith-Jacobs, who's a strategy and program development director at Anthem Inc., but I guess once a nurse, always a nurse. So, and then I am going to let Tanisha tell us a little bit about Black San Diego while we're finishing up this poll.
So hello, everyone. I am happy to be joining this panel of wonderful women who are making a difference in our community. So making Herstory, joining women's health and women's history. Basically, I am one half co-founder of Black San Diego, along with Cherie. We started this platform of Black San Diego 5 years ago in order to uplift and promote Black-owned businesses, entrepreneurs, and business professionals in the community. We have a platform of over 38,000 members now on Facebook. We are climbing on Instagram, and we are also just have a nonprofit section as well. And so we are here to serve our community, to be here in any way possible. Every last Sunday, we do have an event called Dago Eats, where you can come together. And I believe hearing from these wonderful women and what we can do during this pandemic time as far as our health is a perfect way to wrap up Women's History Month. And I'm just elated to be here.
Thank you, Tanisha. I'm going to go ahead and, in the interest of time, just introduce. Really, I don't know if Dr. Aflalo needs any introduction to any of us, but she's so amazing. So we're going to just brag on her a little bit. So she is currently serving as medical director for the Alliance Health Clinic, which provides healthcare for the refugee population. She served as chief of family medicine department for 6 years, held the Southern California Permanente Medical Group professional staff president position for 3 years, taught numerous medical students and residents as an associate faculty of UCSD School of Medicine. But over the past 25 years, Dr. Aflalo has spent most of her free time volunteering in the community, lecturing on breast cancer, diabetes, high blood pressure, heart disease, other health-related issues, and of course, most recently, this COVID-19 pandemic. She is deeply passionate about working specifically with minority and underserved communities, unapologetically so, I might say, educating, encouraging, and empowering people to obtain the best health possible. She's organized several health fairs and health screenings at barbershops, churches, and community events, and she's going to give us a little overview about Black women in medicine. Dr. Aflalo.
Yes, good evening. I have the pleasure of trying to put together a lot of history in 10 minutes, so I'm not going to be able to do justice to all of these women that are have been in medicine that's paved the way for all of us to really make a difference in our community, but I'm going to probably give 1 or 2 sentences on each person that pops up on our screen. So let's go. All right, so Miss Biddy Mason, you can read a little bit along there, but basically, obviously in 1818 and 1891, she was the first African-American nurse, and she actually was a real estate entrepreneur. And she was one of the ones that founded, she was the first person that founded First African Methodist Episcopalian Church, AME Church in Los Angeles. Next slide. Miss Rebecca Lee Crumpler, 1831 to 1895, an African-American physician, nurse, and author. So she was first African-American woman to become a doctor in medicine in the United States. She attended New England New England Female Medical College in 1864. And she published a book called Medical Discourses. Next slide. Miss Suzy King Taylor, 1848 to 1912, first Black Army nurse and cared for the all-Black Army Regiment named 1st South Carolina Volunteers, and later it was redesignated as the 33rd United States Colored Infantry Regiment. And like many other African-American nurses, she was never paid for her work. Next slide. Miss Sarah Fraser, 1850 to 1933, American physician and pediatrician. And in 1878, she was the first woman, African-American woman to graduate from Syracuse College of Medicine. She's the 4th African-American physician in the United States and the first female in the Dominican Republic. Next slide. Miss Sophia Jones, 1857 to 1932. I'm sorry, 32. Canadian-born medical doctor, first Black faculty member at Spelman College when she was hired in 1885. She organized Spelman's nurse training program and led their infantry. She was also passionate about public health and health equity. Next slide. Miss Ida Gray, first African-American woman to become a dentist in the United States. So she was the one that entered into that realm. Let's have the next slide. Miss Anna Decosta Banks, first head nurse in Charleston, South Carolina. She served as a superintendent at a training school for nurses for 32 years. And then later they named the hospital after her in honor of her, McLennan Banks Memorial Hospital, specifically designed for women of color. Next slide. This is the 25th Station Hospital. This was an all African-American unit of nurses who served in the Army Nurse Corps during World War II. And they were the first African-American group sent overseas and were stationed for a short while in Liberia, in 1943. Next slide. Miss Betty Smith Williams, founder of the National Black Nurses Association, the NBNA, and we have our local chapter represented by Jalisa on our screen here. We have a local chapter, San Diego Black Nurses Association. And she's Miss Betty Williams, she's the first African-American nurse graduated from Case Western Reserve University. Next slide. Miss Sadie Beatrice Curry, she's the first African-American female gastroenterologist. Next slide. Alexa Irene Kennedy, she is the first African-American that became a neurosurgeon. So that's pretty impressive. We all know about Ben Carson, but truly our hero or shiro should be Miss Alexa Kennedy. Next slide. Miss Rosalind S. Elizabeth Payne Epps in 1930 to 2014. Pediatrician and public health physician in 1988. She's the first African-American and first woman to become president of the American Academy of Pediatrics in Washington, D.C. Next slide. Minnie Jocelyn Elders, pediatrician and public health administrator. She was a vice admiral in the Public Health Services Commission Corps. She's also the first African-American to serve as Surgeon General. Currently, she's a professor emeritus of pediatrics in the University of Arkansas in medical services. Next slide. Next slide. Yes, there we go. Miss May Carol Jemison. She is an American engineer, physician, and former NASA astronaut. She was the first Black woman to travel space, and as a mission specialist aboard the Space Shuttle Endeavour in September 1992. Next slide. Dr. Donna Marie Christensen, first woman physician and first African-American physician in the United States Congress of Virgin of the Virgin Islands. She was a fourth elected non-voting delegate in the United States House of Representatives and served there from 1997 to 2015. Next slide. Patrice Harris, psychiatrist and the first African-American woman to be elected president of the president of the American Academy Association, American Medical Academy Association. She's the number 170th president, and she was elected in June of 2019. So she is still representing us on the medical AMA. And then next slide. We have Nadine Burke Harris. She's Canadian-American pediatrician, and she's the first Black person to serve as Surgeon General for California, and she was nominated and appointed in 2019. And she is serving us now, as she has, I think she participated in one of our events earlier this year. So with these wonderful sheroes that have paved the way for us, you can see that we've had plenty of talent and skills along the way. So don't get it twisted that we have been in history for a very long time. And we continue to pave the way for great things in our society, trying to take care of our minority populations, but really representing the Black community well. So with that, I'll turn it over to the next panelist.
Thank you, Dr. Aflalo. Isn't it interesting to just take a glimpse into the work that of the women before you, and then you're in the middle, and the women that are coming after you. And you know, we don't even have time to talk about the trials, the tribulations, the racism, the battles that we know they all went through to get here. And for us to have the first African-American president of the AMA just last year is just that, right? We still have a long ways to go, but we will get there for sure. Thank you. Our next speaker is Dr. Kelio Elmore with Viva Life Health Hub. She's a board certified OBGYN healthcare executive and chief wellness officer for clients across the globe. She told us earlier that she tells her clients across the globe to come to our Black COVID Facts SD website to find out what's going on. That's amazing. So while Dr. Elmore considers her practice Viva Life Health Hub in San Diego as her home, she travels the world and sees most of her private medical concierge patients virtually. I love her life motto. She says, to educate, encourage, inspire men, women, and youth to Viva Life, starting with their health. So when she's not helping patients, she's giving back to the community, serving as an advisory member of the Logan Heights Community Development Corporation here. And she also participates in humanitarian surgical missions and global education. Geez, Dr. Elmore, when do you get time to do all of this? Thank you so much.
Thank you so much. Thank you for having me on here. Thank you so much for putting this platform together. My goodness, I have lived in San Diego on and off for the past 30 years. And when I was here, I did not meet a Black physician until I actually went to, I usually say until I became one, but really it was when I was at Xavier University of Xavier University of New Orleans, Louisiana, where I went to undergraduate, and then the University of Chicago Medical School. So this experience is so important to me. Dr. Aflalo, I have always admired her, and I continue to admire her to this day. She is an amazing woman, first of all, as well as a colleague, fellow physician, and she brought me into the fold. And you know, the interesting thing about it is, when you go to a HBCU, when you're a Black physician and you're the 0.001% in the country, we do not compete against each other. It's all about collaboration. And I think that's so important. This past year, actually these past couple of years, with the Viva Life Health Hub, it's been in play for at least 5 years. And I've been in private practice on my own for about 10 years. Running a consulting business, as well as practicing women's health in the community, and doing that on a volunteer basis as well as a non-volunteer basis. But when I needed to bring the professionals as well as the consultants to the community. It was Dr. Aflalo that helped me to do that. My goal, like I said, is to educate, encourage, and inspire. And essentially what I try to do is make sure that I'm available for mentorship, sponsorship, and advocacy. I always start with health. Health is number one, physically, mentally, emotionally, spiritually, and I also say financially, because you cannot live your best life unless you have all of those things in play. So very important also is that, you know, I live here in this community. I live in the 92114, and we call it the 14 for short. And we also have a nonprofit. My husband is a CEO in 92102, which is Logan Heights. And as a matter of fact, he is down at the convention center right now with his COO. And they are a part of the program for the immigrant children that are being, you know, housed and educated right down there in that convention center. And it is truly a beautiful thing. I'd also like to say that working with the San Diego Black Nurses Association, they invited me to speak at one of their events when I was a brand new graduating resident. They brought me into the fold so I could understand and know the community. And, you know, almost 20 years later, we're working in the Logan Heights area together, bringing immunizations to our community members. So that's just such an amazing thing. I always tell people that, you know what, when you're a young doctor, you know that if you don't get along with your nurses, you are not going to have a good experience. So making sure that you give our nurses their props, because they're at that bedside, they're taking care of the patients, they're advocating for the patients, and it's so very important. People ask me all the time, you know, Dr. Elmore, first of all, how do you have time to do all the things that you do? And the reason why is because I have a village. I have a village of friends, colleagues, sorors. Many of them live in San Diego. Many of them live across the world. Like you said, I have done humanitarian surgical services for the first time in Fiji a couple of years ago. One of my colleagues, OBGYN, she invited me, and we, you know, raised money, and we went to Fiji, and we operated for an entire week on beautiful Fijian women who truly appreciate all the care and the, you know, operative and surgical experience that we're able to offer. But for me, I always wonder, why can't I just do this in my own county? And then I found Champions for Health and found out, you know what, we can do this in our own county. And there are hospitals that will give or donate time as long as we have the surgeons available to take care of those people. Unfortunately, COVID threw a little wrench in that, but that is definitely something that we need to look at, because there are people that kind of fall outside of the Medicaid, Medicare, and don't have insurance, but they still have chronic diseases that need to be addressed. And as an OBGYN, making sure that women have their up-to-date pap smears, HPV testing, sexually transmitted disease testing, contraception, and you know that we are highly affected by fibroids. And July is Uterine Fibroid Awareness Month, and it's one of those things that we have worked very closely with Dr. Shirley Weber, Dr. Akila, and the San Diego chapter of Delta Sigma Theta Sorority Incorporated to have that here so we can make sure that women are aware of all of the opportunities that are available for them, not just hysterectomies. So bringing, you know, specialists to our community is so important. One of the other things that Viva Life Health Hub does is we used to have the annual health fair. And honestly, I got the idea from Dr. Aflalo, but I wanted to take it to a different point and bring in specialists. So we bring in dermatologists, we bring in ENT, which is your ear, nose, and throat surgeons. We bring in the gastroenterologists and the GI surgeons, because it is so important, because most of us will never get the opportunity to actually see specialists depending on the type of healthcare we have, just because it takes a lot to get from primary care to specialty care if you're not financially, you know, if you're not at that financial level or you don't have the insurance. Besides the fact we really don't have a lot of people that look like us that have those specialties. So it's really important. And another thing that I'm really all about is bringing in specialists to San Diego. I just left from having a few moments with a specialist who is considering moving to San Diego, who looks like us. And it's so important that we have different specialists that understand our culture, that understand where our point of view and where we're coming from. But you know, what we need with that is they too need housing. They need their loans paid off or paid down. So that repayment is very important, because most doctors graduate with $200,000 to $400,000 worth of loans. Everybody thinks the doctor is rich, but in all honesty, it takes a lot to get there. So making sure that we are bringing our diverse population of physician and physician specialists, both primary care and specialists, as well as our advanced practice nurses and PAs here to San Diego, specifically our Brown and Black communities, is so important. And, you know, lastly, I have to say that our Cradle to Career program that we have started. So we opened a preschool called Future Achievers that's under our nonprofit Logan Heights CDC. And we are talking about collaborating with our major universities so that preschoolers, and I'm talking 2 to 5 year old, when they graduate from preschool, they need to have a full ride to college. And if possible, if we can get them into the STEAM fields, medicine, engineering, science, and math, and have graduate education available for them as well, we need to be able to do that too. So because I'm a physician, I want to be able to open all of those doors for the people in our community, people that need it, people that want it, and people that are willing to work for it. And we just want to be the advocates for them.
That's amazing. It's amazing work. And I don't know if all of you even knew. I didn't know half of that was going on in the community. And yeah, let's get them at preschool. Absolutely.
Absolutely.
Yeah, Tanisha, you got a couple of little guys. Get them revved up for success. Thank you, Dr. Elmore. In the third piece that we've been talking about nurses is that I'm going to introduce Jaleisha Smith-Jacobs. She is actually a strategy director at Anthem, responsible for relationship management, client retention, and growth for the company's healthcare, fraud, waste, and waste solution. She's also a member of the San Diego Black Nurses Association and the co-chair for their COVID-19 task force, where she and other members of the task force have taken on the charge to secure vaccines, to administer at events in the most diverse areas of San Diego. And since they began holding events, the percentage of African Americans among people that have been vaccinated has increased from 2% on February 16th to 2.5% as of March 22nd. In a little over 1 month, the task force has administered over 1,750 Moderna vaccines through 100% volunteer effort and community partnerships. That is pretty impressive. And, you know, Dr. Aflalo, I'm going back to Biddy, who wasn't paid for her services as a nurse. Is this the 200-year trend? All right, Jaleisha, tell us a little about what you're doing.
Yeah, so I'm really excited to be with you all, and I just have to make a comment about Dr. Aflalo. She is my mother's favorite nurse. So every event and the many that she holds in the community, my mom is there and cannot wait to speak to Dr. Aflalo. Dr. Aflalo's her preferred second opinion. So anything she hears from her PCP, she runs to go confirm with Dr. Aflalo. So just really excited to be here on this panel and to talk about not only the work that the San Diego Black Nurses Association is doing, but also the legacy of nurses rising to the occasion in moments of significance like we're in today. So I'm going to speak a little bit about the role of nurses in the San Diego community during the pandemic. The photo that's in the background on that title slide, it's Samantha Williams, who is my co-chair on the COVID-19 task force with the San Diego Black Nurses Association, giving a hug to the nursing director for the Southwestern Community College nursing program there. Next slide, please. So before I talk about the role of nurses in the San Diego community, I think it's important, and being that it's Women's History Month, just to take a step back. And there's been a lot of parallels that have been drawn between the current COVID-19 pandemic and the flu pandemic of 1918. And want to make it known that Black nurses, just like I will share in the next slide, in San Diego are making a difference. Black nurses were making a difference for that pandemic as well. So as Dr. Afalo mentioned, she showed a slide with some Army Corps nurses that were able to serve in World War II. So prior to World War II, Black nurses were banned from serving overseas. But that also created a very great position for Black nurses and Black healthcare providers, because they were at home and able to manage the flu pandemic that was ravishing communities. There were a number of nurses who really not only elevated their Black community, but also the profession of nursing. One is Frances Reed Elliott Davis. She was the first Black nurse to be enrolled in the Red Cross and served in Tennessee, treating both Black and white patients during the flu pandemic. And then also in the center of the slide, these are Black nurses that served at Fort Sherman. So the Fort Sherman story is actually really interesting. So they were an Army base in Ohio, and they had the highest death rate among Army bases in the United States. And there was an article posted in the newspaper saying, "We need help. If there's any skilled available nurse, please come right away." And a Black nurse drove and showed up to provide assistance, and she was turned away. Told that we don't need your type of assistance. She persisted, and she went and grabbed a superintendent, got some support from some local Black organizations. And then a few months later, not only she, but a host of other nurses were brought into Fort Sherman. And because of their efforts, they were able to bring down the death rate at that Army camp. And not only were they successful in bringing down the death rate, they were also asked to stay at that base to take care of soldiers coming home from the war. So they made a difference, and they also opened doors for these largely white healthcare institutions and our Army bases to recognize the skill, the strength, the power, and the excellence of Black nurses. So I wanted to provide that backdrop to say that Black excellence, as Dr. Afalo showed, is nothing new. Nurses rising to the occasion of these critical moments in the world, and particularly to our well-being, is nothing new. We answer the call each and every time. Next slide. So thinking about what's happening today, so the San Diego Black Nurses Association is making Herstory today. So and it's really been, as Leah mentioned, volunteer effort, but really fueled by a passion for the Black community here, and also other communities of color, and also a determination to create more equity in the administration of vaccines. The San Diego Black Nurses Association has secured a regular flow of vaccine and have been leading pop-up events across San Diego and our most diverse communities to reach residents. And there were some statistics shared. We just had a couple of events last week, so our numbers are even higher. So again, before we started doing this work, the percentage of people that had received vaccines, only 2% were African American. And just to give some context, we make up a little over 5% of the San Diego population. So less than half of the people that were eligible to get the vaccine and should have been vaccinated were actually getting vaccinated. And we were seeing other ethnicities like Asian Americans and white Americans in San Diego that were receiving vaccines at rates that were proportionate to their population distribution in San Diego. So we decided to do something about that and to create more equity. So we had our first event at the George Stevens Center, and we've had our most recent event at Bethel AME Church. So across those 9 different events, we have now administered over 2,200 doses of the Moderna vaccine, and the number goes up every single week. So as was mentioned, before we started these events, literally days before, the percentage was 2%. We are now up to 2.6%. So every week we are having these events and we are seeing numbers go up among African Americans getting vaccinated. And if you have the opportunity to be at one of these events, either as someone getting vaccinated or as a volunteer, and we need volunteers because we can't do what we do without the volunteer support, you see people at these events leaving feeling hopeful, feeling cared about, feeling seen, feeling loved, because we are meeting them where they're at. We hear from our community residents that they don't have time to take off of work to go sit at a super station. They can't drive up to Del Mar and go to that new super station. There's not good public transportation. So we are making sure that our events are as accessible as possible, having them on weekends, having them on weekdays, and making sure we're in the heart of the community to reach those who need the vaccines most, especially because we saw some statistics early on in the pandemic where African Americans were experiencing more severe outcomes related to COVID-19. So just a couple of pictures here I want to highlight. The members of the San Diego Black Nurses Association, and also the critical volunteer support that we've been receiving. So in the photo at the bottom on the left, we have one of our SDVNA's task force members, along with a trusted volunteer partner who is a nursing student at Southwestern Community College, getting ready to administer COVID-19 vaccines at Bethel AME Church. The next photo over, and I have to just talk about Miss Laura. She has been a nurse since 1957. 1957. And she is at Bayview Baptist Church filling out registration forms for our community members so that they can get vaccinated. I mean, I was in awe seeing her at the event working the full day, but just even reflecting on this is the heart that the San Diego Black Nurses Association has for this community. And then we also have our medical director, Dr. Gillespie, with some nursing students that we've partnered with at our events doing their try elbows. Just celebrating the good work that they've done in the community. So next slide. So to answer the question, what are the roles of nurses in the San Diego community right now during the pandemic? While we are certainly clinicians, we are also educators. So we're not letting the moment pass when we have our community members to talk about their overall health and well-being. We are mentors, so we are working with a whole future generation of nurses that are volunteering at our events, and we are mentoring them and bringing them up in the profession. We are advocates, so securing those vaccines specifically to distribute to our community members to make sure that they are seen and that they are included in the numbers of those being vaccinated. We are counselors, so we definitely have talked through with a lot of community members around vaccine hesitancy, and making sure that if that hesitancy exists, and for many people it exists for good reasons, because there are very real health and healthcare disparities and inequities that are present and impacting our community, but making sure that we're able to provide information so that community members can be informed decision makers. And we are also trusted partners. So walking the talk, what we are representing, what we are doing in the community, we're making sure that we're doing it ourselves. So whether that's getting vaccinated, whether that's practicing appropriate social distancing and masking. And in the background, this is a photo from the Black Women's March that was held in 2019 in Southeast San Diego. We marched down Imperial, and I saw this sign that I thought was so perfect. It says, "I'll just do it, Black women." Whether it's talking about an election, whether it's talking about taking care of our community, securing vaccines and getting our members vaccinated, Black women, we just do it. And nurses in particular, very true, we just do it. So ultimately, while we are clinicians, educators, mentors, advocates, counselors, and trusted partners, we are essentially also whoever our community needs us to be at that time. We just do it.
That is so beautiful. Well, and I think that "I'll just do it" theme for Black women would have went for every single woman on the slide presentation that we just saw. And you know, we're talking about the vaccine in our community, and when Tanisha and I were talking about this work that I was doing, you know, she said, you know, a lot of her members had some questions. Tanisha, do you want to join us with that? Oops. You got to take your mute button off.
There we go. So yeah, so Black people have mistrust when it comes to receiving vaccinations, and more than asking like, what can you say that would make them get vaccinations, it would be like, how can you help them navigate in a system afterwards that kind of may require them to have it? Like, how can they navigate if they choose not to receive the vaccination?
Thank you. So what do we how do people stay safe, or they're making that choice not to take the vaccine? What would you suggest for them, ladies?
I would say that the most important thing is they obviously need to make that decision for themselves, an informed decision. So staying educated, you know, joining the website to get more information until they feel comfortable to get it, asking proper questions. But the most important thing is just continue to do carrying out the safety measures of wearing their mask, washing their hands, staying socially distanced away from everyone, because they can't afford to risk getting the virus, because we, people of color, especially if we have chronic and underlying medical conditions, are at higher risk for getting seriously ill, landing up in a hospital, and possibly dying. So we have to take serious precautions. So I would never force anyone to do anything. I would just encourage them. I've run across a few people that are hesitant more than just totally against it. And by the time I finished talking to them and letting them know, number one, I got mine and I haven't grown an extra ear or horn in my head or something. I'm still fine, had minimal symptoms, spoke about that, but that try to address the actual concerns and fear that they have. And maybe try to help debunk the myths that they were exposed to early in this whole thing a year ago, when this was very political, and some of the people in social media were deliberately targeting Black people, because if we could plant more fear, then they would stay away from getting the vaccine, and they would also continue to socialize. You know, they were saying that young people can't get in and Black people can't get in, this and that. So they believe that, and they were still out there socializing, but we're the ones that are getting sick. And if the young people went out and socialized with their friends, they brought it home to their grandmother and their mothers, they died. When we all gathered for a funeral and didn't quite do the right thing, you know, many more people died from just attending a funeral of someone that died. And so we finally got it months later that we really need to pay attention, that they're not really for us. They are trying to continue to sabotage us, and we need to listen to people that you really do trust and understand that this is not Tuskegee. That this is something different, that we're not being experimented on. We are really trying to, at least the community that we're serving, we're trying to tell them that it's safe to get it. We just have to wait until they wrap their head around the information, but get proper information. Stay away from social media in terms of the misinformation, and try to go to websites and other places, CDC and, you know, other places that have correct information. And if you don't understand it because it's too technical or too scientific, ask someone that does. And then eventually they'll come around because they'll start seeing their friends and family members getting vaccinated, and they too want to get involved. They don't want to be left out in the cold. They don't want to not be able to gather with their families. And this gives us an opportunity to get closer to normalcy if we can all start getting vaccinated. So to be honest with you, I don't see nearly as many people that are totally against it. I'm actually running across people that are desperate to get it and just can't get access to it. So I'm getting more issues of access. And therefore, that's why I'm joining in with the nurses and doing my own thing of setting up vaccination sites to get as many people vaccinated as possible. With two examples, the governor asked us to do something within our community with faith-based leaders and local organizations. So we have 1,000 Johnson & Johnson vaccines that we're giving out at City of Hope International this Saturday. And then we have another 1,000 Johnson & Johnson vaccines we're giving out at our health fair next Wednesday. So if people are ready, we've got 2,000 vaccines. We just need 2,000 arms.
And I'd just like to add to that, what Dr. Aflalo was saying. I do actually have patients that are non-vaxxers. So patients in the past, whether, for their children or themselves, they are non-vaxxers. And so I completely understand their position on that. That being said, I think the things that they should focus on, as we all should, is focusing on our wellness and health. So these chronic diseases, the acute diseases are still there. We need to make sure that we don't have diabetes. And if we do, that we're reversing that diabetes by eating right, by exercising, by checking our sugars. The other thing is I was able to work with one of the companies or organizations here about getting blood pressure cuffs out to the community. We have high blood pressure. We don't know that. The numbers have changed. We need you to be lower than 130/80, really less than 120, in the 120s over 70s. So making sure you're doing that, making sure you're getting adequate vitamin supplementation if you're low in different things, vitamin D, vitamin C, zinc, all of that, very important. Staying hydrated, getting rest. It is amazing what 7 to 8 hours of sleep will do. And I know a lot of people, yes, I'm a physician, I'm a mother, I'm a wife, I'm a daughter, I am an activist, all of that. And so, yes, it's very hard to get at least 7 hours of sleep. But I tell you, when you are very ill or sick, what does your body make you do? It makes you rest. So if you can prevent that, if you can practice preventative medicine, that is an absolute one of the best things that you can do for yourself, along with all the things that Dr. Aflalo said.
Yeah, thank you, Dr. Elmore. Delisha, do you have a comment on this?
I think I just wanted to echo Dr. Aflalo's comments about watching your sources and making sure that you're going to trusted sources for information. So whether it's the Black COVID SD site, the CDC site, as she mentioned, or talking to trusted messengers, it's very important to make sure that your information is accurate. And I think a lot of us, social media has become such a big part of our lives, and it's also become a primary place where people get information. And there's not a clear distinction between opinion and fact. So would just encourage making sure that you're going to trusted sources and you're making those informed decisions based on trusted sources of information.
And I think that is really the work that you guys are doing, really being in the community, and that is a fact that we want to hear it from ourselves, and I think that that's true. Now I'm going to just pivot on this question from the audience about that, because it's tied into the vaccine, which is, what about people that are drug users or are prescribed strong medications? What about them being vaccinated?
I'm assuming the question is, are they eligible to be vaccinated if they're
Right.
drug users? To be honest with you, everyone at this point should get vaccinated. And the people that are at higher risk of getting very ill if they get the virus should be vaccinated. So I would just say that, yes, they should be vaccinated unless there's some other contraindication that someone knows that I don't know. I know people are afraid that, oh, if I have this and I have that, maybe I shouldn't get it. No, you're actually the one that should be in the front of the line because you're at higher risk than some of the other ones. And at this point, most people know I don't follow the rules. So anyone that has a little brown in their skin, to me gets vaccinated. I don't necessarily follow the criteria. And as of tomorrow, everyone 50 and over is eligible, regardless of what, you know, medical condition they have or not. And then on the 15th, everyone 16 and over is going to be eligible. So we're pretty much there. I just kind of beat them to it. You know, I just started vaccinating whoever, if they're in a car or they got some brown skin, there are needles going in their arm if they want it.
And then the new information came out about the research for the children, the youth, as you mentioned. So they do have new research out about that. So I'm sure Black COVID Facts San Diego will be publishing that information as well.
Absolutely. Please, the website is being updated really quite frequently. And this is a lovely question to all panelists. Is there a woman of color that influenced your decision to enter in your profession?
Well, do I get rights because I'm the oldest one here on this panel?
Sure.
All right, bragging rights. My mother, actually. My mother was my mentor, my all, everything. And she actually studied to become a nurse and got her degree at the age of 50, has 5 children, was a single mom, and was studying for getting her nursing degree when I was in middle school. And so I was helping her with her flashcards with microbiology. And that's probably why I got involved in medicine, because of her nursing degree. So number one, you're never too old to go and do something that's a tribute and doing God's work. But also she was just everything. And so when I aspired to go into medicine, I wanted to make her proud, if nothing more. And so as she looks down on me now, the work I do now, I mean, I'm not retired, is God's work, but it's also to make her proud. So my mother is my shiro.
That's fabulous. Thank you. Dr. Elmore, is there someone that inspired you to?
Just like Dr. Aflalo said, my mother, she is not in medicine, but my mother, when I said I wanted to be a doctor, I said I was called to the Ministry of Medicine when I was 6 years old. I had not met a physician except for the pediatrician that I probably saw, or the obstetrician that delivered me. But I, woke up and I said, something told me, this is what you're supposed to do. And because in our family, we have had most of the things that Black women have had to deal with, domestic violence, sexual violence, as well as just not having access to good health care, I decided that, yes, absolutely, I want to be a physician and I wanted to be an OBGYN. But it was Margaret Elmore and it was Ora Marie Cunnan and Mary Jones, who were the matriarchs in our family that said, yes, you can do anything that you put your mind to. And my mother sacrificed, and she continues to be in our home today, making a difference, praying with me every day, making our home beautiful, making our home filled with love and spirituality. And that's the reason why I am where I am today. And besides that, there were definitely Black physicians once I started getting into college and med school that definitely helped me. And like I said, Dr. Aflalo has been one of my epic superstars.
I love that. Epic. We're going to add that as a little verb in front of your name. Well, you probably won't let us, but it'll be on the slide. Shalisha, how about you?
Yeah. I'm going to mention an undergraduate professor that I had. It's hard not to mention Jacqueline Jackson, who is my mother and a force in the community and in the States, and a disability rights activist. But thinking specifically about my nursing career influence, Dr. Lisa Lewis at the University of Pennsylvania in Philadelphia. She was my first and only Black professor in nursing school. And I was one of just a handful of African-American students. And she is the one who brought in my perspective of what it would mean for me to have a career in nursing. I was very self-focused with a lot of individual ambitions. I wanted to be a chief nursing officer of a hospital and kind of take over a health system. But after working with Dr. Lewis, I developed a passion for eliminating healthcare disparities and started diving into work around environmental racism and how that was impacting healthcare while I was in nursing school, and also working with the U.S. Department of Health and Human Services Office of Minority Health with their preconception health campaign, A Healthy Baby Begins With You, and traveling the country to do work to reduce infant mortality in the Black community. And finally, I came to terms with myself and said, you know, I'm not going to be a CNO, but what I do want to do is change the world. And I wanted to do that through eliminating healthcare disparities. And she was someone who didn't think that that was an insane idea, having an individual wanting to change the world. So she encouraged me and stayed in contact with me and continued to encourage me as I pursued my master's in public health. So Dr. Lisa Lewis, I have a lot of gratitude for her.
Amazing, amazing. Now, Tanisha, you didn't go into medicine, but I'm sure there may have been a Black woman who inspired you along the way to do the things you do to make a difference.
Yes, my mom, first and foremost, she got pregnant with me at 19, had me at 20, and just has always been there. And though I am not a doctor, I graduated with my bachelor's in kinesiology. I do teach physical education, and so I'm all about nutrition and movement and just getting out there and staying and being healthy. So yes, my mom, thank you.
Perfect. Where are we at time? We have a question in the chat, which would be, what advice would you offer young African-American women who may be interested in the medical field? And what can we do to move more Black girls interested in STEM careers? Well, I mean, Dr. Kelly's moving that mountain, but what advice would you offer?
The advice I would say is, first of all, you can do it. Write it down, envision it, see yourself doing it. So you have people on here, and we have a lot more positive images in social media, and they're out there. Second of all, I would say reach out to those Black physicians or those physicians and ask them to help mentor you and guide you. Also, if we want to, for example, Cynthia James Price mentioned, we have the Leadership Development Internship Program through the San Diego Delta Foundation, which is very much focused on getting young women into fields that they want to be. And if you wanted to be in the STEM or STEAM field, we can do that as well. And like I said, that cradle to career is for real. There's so many programs as far as, you know, for example, one of my best friends, she's working with Google, and they are putting on a full-on STEAM program for high school students in Chicago. And we're trying to scale that to other cities so we can make sure that we're doing that in various other cities. So those are the main things. And the other thing is, your education should be free. And I really mean that. The reason why you should be working really hard in middle school, elementary, middle, high school is so you can get and go to college for free. There's plenty of scholarships that are out there to go to college. And there's even scholarships to go to medical school. I went to school absolutely free on the health professions scholarship. And they paid for the University of Chicago, all $400,000 of it, so that I could come out and I did not have to worry about the burden of finances. So I got to start early where I could give back to my community earlier because I just didn't have all the weight of money on my shoulders that other people did. So those are just a few things that I would recommend in trying to become a physician. Number one, you can do it.
You can do it.
And to echo what Dr. Elmore mentioned, absolutely. I think for anyone who is a parent, who is an aunt, auntie, godmom, anybody who has a child in your life, absolutely. The ticket to getting to college and having that paid for begins early with getting children involved and supporting their academic process. And like Dr. Elmore, I was fortunate enough to get the Bill and Melinda Gates Millennium Scholarship and was able to attend my undergrad and get my master's degree for free, absolutely free. So there is a freedom in being able to enter life and career without student loans. So absolutely, if you have the opportunity to impact a young life around you, please encourage that. And just to touch on nursing, nursing is one of those phenomenal fields where you can do anything from being a nurse anesthetist, so meaning you're able to do anesthesia, work during surgery, to being a public health nurse, to even doing what I'm doing with Anthem, a health insurance company, and fighting fraud, waste, and abuse in healthcare. It can take you anywhere. And the great thing about nursing, which makes it one of the more equitable careers to get into if you're interested in healthcare, is that you don't have to go to a 4-year degree program. I know the tuition and the barriers can seem very intimidating, but right here in San Diego, we have Southwestern Community College that has a fantastic nursing program, and their nursing students are primarily students of color, male and female. We have Concord, who has been partnering with the San Diego Black Nurses Association as a way to enter the nursing profession. And we certainly have our 4-year degree programs like San Diego State and University of San Diego, Point Loma Nazarene, but nursing is one of those careers where there's multiple ways to get into the profession, and it can be affordable, especially if you're going like a Southwestern or a Concord route. And then once you're in the career, you can really shape it based on your passions and interests.
And I'd just like to add one more thing, because we did talk about the academic route. The sports route is also a wonderful way to get your education paid for, as long as you focus. I didn't know that you could be a professional athlete. So I have friends that were professional football players, gymnasts, baseball players that chose, after they finished their professional tours, that they chose to become physicians. So definitely have that route as well. So anything that is legal, that will get you educated. I always say that. That will get you educated. I always promote that. So academic, sports, all of it.
Perfect. Okay, well, we're gonna.
I'm glad you added sports to that, because a lot of times people are like, we should go other ways, but there's nothing wrong with it. Just get there, get your education paid for, and go from there. If there's a gateway to get there, make it happen. So I'm glad you added sports.
And great leadership skills, teamwork, collaboration.
Mm-hmm.
To become a physician who decides to be at the table, that's going to be very important as you become a healthcare executive in the space.
That's perfect. Well, I can't believe it, but we are very close to time. I know we want to throw a poll up and see if everyone feels the same way as they did when they started this conversation. And I'm just so grateful for Dr. Aflalo, who I have known for a couple of decades, Jaleesa Smith Jacobs, who I actually knew when she was a teenager because I know her mother, Dr. Kelly Elmore, and Tanisha T, for just spending this time with us. You know, this partnership is what it's all about, all of us working together to make a difference for our communities and ourselves. So go to Black San Diego, the app, and, you know, find out so many things, so many amazing things that are going on. Hit the Diego Eats, get out here. If you're feeling good and you're vaccinated, I know Dr. Aflalo can always use a great volunteer. You know, being a part of community and being amongst each other, you know, that makes people feel, it makes you feel good. That's why I work in the community and have, because that's what my people are. The community loved me when I came here in '89, and so D4 is my district. Okay, so stay online. If you aren't signed up, to go to Black COVID Facts and get with our newsletter. Great, Dr. Kelly's giving us her Instagram. If you guys want to put in the chat where everybody can reach you or sign up and connect more. And again, I'm just so grateful. I'm grateful for all of the women, all of the Black women who paved the way for us through all these hundreds of years, so that we could sit here today and be strong and healthy and be making a difference like they did for us. So thank you all for joining us, and be safe. Be safe. We'll get through this. We've gotten through more, haven't we? So we'll get through this.
Thank you, ladies.
Thank you, ladies. It was great spending this time and space with you guys. Good seeing you again.
Yes, absolutely. Thanks for all the good work.